Production funds for this program have been provided by the Whirlpool Foundation.
Each year, hundreds of healthy, normal children and a few adults are stricken with a mysterious and deadly disorder known as Reye syndrome. The exact causes of Reye syndrome are unknown. There's no cure, and federal funding for research into Reye syndrome is minimal. Reye syndrome, often misdiagnosed, always misunderstood, is among the 10 leading causes of death in children under the age of 20. Because Reye syndrome can follow a simple cold, sore throat, flu, chickenpox, or any virus, every child is a potential victim. Reye strikes suddenly, without warning. Unless correct diagnosis is made at once and emergency life support treatment started immediately, a Reye child may lapse into a coma and die within a few hours. During this program, we'll tell you all that's known about this devastating killer. Tonight, we'll talk to families of Reye's victims, medical experts, and Reye's treatment specialists who will describe all the symptoms and details of Reye syndrome. Because Reye symptoms often resemble many other diseases, we urge you to take notes. At the end of the program, I'll be back to give you an address where you can write for a free brochure and additional information. But for now, stay with us as Scott Clark investigates Reye syndrome, child killer in disguise.
The first time Dr. Joel Taubin, a respected and prominent Washington, D.C. physician, heard of Reye syndrome, he was still in medical school. There, he was told Reye syndrome was so rare he would never see a case. And he didn't, not until March of 1978, when his 11-year-old son, Gregory, was recovering from a relatively mild case of chickenpox.
He started to get better from the chickenpox. He developed some profuse vomiting, intractable throughout the entire day, headaches. And he started a personality change, nausea, yelling, screaming, and cursing. Was taken to Holy Cross Hospital and was told he had chickenpox meningitis. At that time, it was even claimed that we may have had a drug overdose from anti-nausea medication. An intern there recognized the symptoms and transferred immediately to Children's Hospital. The diagnosis of Reye syndrome was made at that time.
Once at Children's Hospital, young Gregory lapsed into an irreversible coma within 24 hours and died 2 weeks later, without regaining consciousness.
It was disappointing that not only did I know about it, I'm not a pediatrician, but an internist, that many of the pediatricians thought it was so rare you'd never see a case of it, only 1 or 2 sentences in a textbook.
It's been 7 years since the death of Gregory Taubin, plus thousands of other Rye's victims. Yet awareness about RS within the medical community is still limited. According to the National Reye Syndrome Foundation, many Reye's children are still being diagnosed with other illnesses. They often end up being treated for encephalitis, meningitis, or as in the case of many teenagers, drug abuse. Unfortunately, Reye syndrome isn't discovered until an autopsy has been performed. But more frequently, because Reye's follows flu, chickenpox, and a host of other viruses, Reye's children are simply diagnosed as having a relapse of the original illness. By the time 5-year-old Tiffany Frudenberger's doctor realized the seriousness of her symptoms, it was much too late.
Shortly after she started vomiting, she became disorientated and confused. We did not know what the problem was. The doctor gave us an anti-vomiting medication, and when these symptoms started to show themselves, we realized that something more serious was happening to her. He assumed that it was a reaction to the medication he had prescribed, and didn't become overly concerned at that point. By Friday, I was having to carry her. She could no longer walk, and I begged to have him please look her over one more time. And we took her into the doctor's office, and because she had the chickenpox, we were put off on the side into a little cubicle, and he didn't come to see her right away. And about 45 minutes later, he came in to check her, and she was incoherent at that point, and he was concerned that she might be dehydrated. So he said that we should hospitalize her. We went across the street to the hospital and admitted her, and my husband was out of town at the time, and I had to make arrangements for our other child. And by the time we got a hold of a babysitter to watch her, I had to leave Tiffany in the hospital by herself. And when I came back to the hospital, they were preparing to tie her into the bed because she was so combative that she couldn't counteract what was already happening in her system. They diagnosed Reye syndrome later that evening, and by 10:30 that night we were on our way by ambulance to Columbus, Ohio, which was a 3.5-hour drive from where we lived. 5 doctors were waiting for us at the emergency room. They did the initial test, confirmed Reye syndrome at that point, and the doctors took us aside and sat us down and said, "Your daughter has a 50-50 chance of surviving." Well, from the time she first vomited until the end, 36 hours had lapsed, and that's how fast Reye syndrome can attack a child's system. It was devastating to us.
The Center for Disease Control in Atlanta, Georgia, has conducted a number of research studies into Reye syndrome. According to Dr. Michael Barrett, a medical epidemiologist with the CDC, Reye syndrome attacks every organ in the body, but most severely, the liver and brain.
It's a disease where, first of all, the child develops either a flu-like illness or a chickenpox illness, and this illness does not seem to be particularly unusual. It seems to be the average flu, maybe similar to the brothers or sisters in the family who have the flu, or the chickenpox may just be of similar severity to other children that have had chickenpox. During this antecedent illness, as we call it, the chickenpox or flu-like illness, usually about 4 to 5 days into that illness, they appear to be recovering somewhat, getting over their flu or getting over their chickenpox, and seem to be slightly improved, at least in the parents' eyes. Then around this time where the child seems to be finally improving, they seem to take a kind of a paradoxical step backwards where they get more severely ill, and they develop the onset of usually repeated vomiting in most children. Now, the one exception to that is in the very young child, the child under 1 year of age, where they may in fact not have vomiting, and then it's very difficult to recognize this disease. But most children will develop the onset of vomiting around 4 or 5 days after the beginning of their illness, and this is not just one episode of vomiting, but tends to be very progressive, what we call intractable vomiting, where they will vomit 5, 10, 15 times a day, and in fact when have dry heaves if there's nothing for them, nothing in their stomach. This vomiting then is often accompanied by changes in their mental status, and what children will first of all do is seem to be disoriented, not recognize their parents, not know where they are, will say crazy things like they are hallucinating, and in fact they do seem to be hallucinating, and then they will progress on to becoming combative and fighting off their parents, thrashing about, seeming quite out of their heads, and then following that they may progress on to coma. And when the child progresses on to coma, at that point that's of course where the prognosis becomes more severe, and at that point the child clearly has to be hospitalized. One of the keys in this disease is early recognition and treatment. If you recognize a child before they become very severely ill and comatose, we believe that there may be a chance to reduce the likelihood that they will go ahead and progress on to coma, or at least to increase the chances that child will survive.
Georgetown University Hospital in Washington, D.C. has one of the few Reye's treatment centers in the country. We talked to Dr. Angel Colon, who has treated a number of RS cases here successfully.
They get put in our intensive care unit immediately and get put on what is called our cerebral edema watch. Cerebral edema meaning swelling of the brain. They get monitors put on them for heart rate, respiration rate. We insert what's called an A line, an arterial line, which is a catheter that goes into the radial artery so that we can measure directly blood pressures, and we can measure blood gases, how the lungs are working and how the exchange of gases are going. We have in another line, on another arm or another extremity, we have concentrated solutions of sugar going in to try to reduce the brain swelling. If the child is progressing well and there is no further evolution, that's as far as you have to go. If it looks like the child is continuing to evolve Reye syndrome despite these treatments, then we put in what's called an intracranial monitor, in which a burr hole is drilled through the skull, and right on the dura of the brain, a little transducer is put to measure directly pressures in the brain. And then we can record those, and we have a direct number reading, both analog and digital reading, of the pressures in the brain, so we know where we are in terms of treatment.
8-year-old Lynn McCune of Haddonfield, New Jersey, was stricken with Reye's after a slight cold. Her case required more radical treatment, which involved extensive surgery.
It was the second day, I guess, of treatment when we were faced with a decision as to either try a craniectomy, which is a procedure where they remove the front part of the skull in order to allow the brain more room to expand. And if we didn't do that, in all likelihood, she would have died. So we obviously took that approach, and that saved her life.
Although her life was spared, Lynn is not without serious disabilities. Now, at age 14, she is severely retarded, unable to speak, and functions at preschool levels. Lynn is unable to walk without assistance and must have constant supervision. In all probability, she will remain in this condition for as long as she lives.
Actually, we make her do as much as we can for herself, and we try not to do too much for her, because then she'll just let you continue to do things for her. You try and make the child as independent as possible, and that's what they teach them through therapy. And it's hard as a mother to, you have to keep reminding yourself to make her go get it. If we don't, one thing that's very hard is she becomes frustrated when we don't understand what she wants. And so one thing we'll do is we'll say, okay, Lynn, you go show us what you want, you go get it. And so she'll get up and go over to whatever it is, and then kind of just by pointing to it or showing us what she's looking at, then we can kind of get a feel for what she's talking about.
The question that remains is, what causes this devastating killer? Researchers have considered pesticides, household cleaning products, many other environmental agents as a possible cause. But none of the studies have been so convincing as the one showing salicylates, the generic term for aspirin, as the #1 culprit.
There have been a number of studies prior to this which have suggested that some medications, particularly aspirin, might be related to an increased risk of developing the disease of Reye syndrome. The Public Health Service, during 1984, conducted a pilot study, that is a study to test the ability to carry out such a study. And during that study, we asked parents of children who developed Reye syndrome and healthy children who did not develop Reye syndrome what medications they took during their flu-like illness or chickenpox-like illness prior to developing Reye syndrome. So this is basically a large epidemiologic study where we interview people, and we carried this out throughout the United States during 1984. And the full study is currently ongoing, was conducted last year during the flu season, November to April 1985, and is continuing now and will go on through the flu season of 1986.
According to this study, the overwhelming majority of Reye's kids had taken aspirin, leading some scientists to believe that salicylates, the generic name for aspirin, somehow triggers Reye syndrome. Well, because of this link, the American Academy of Pediatrics and the National Reye Syndrome Foundation is urging the Senate to pass the newly introduced Waxman-Metzenbaum bill. This bill would require drug companies to place a warning label on all aspirin and aspirin-containing products. The proposed label clearly states, this product should not be given to individuals under the age of 21 years who have chickenpox, influenza, or flu symptoms. This product contains aspirin or another salicylate, which has been strongly associated with the development of Reye syndrome, a serious and often fatal disease. Earlier this year, Congress had asked pharmaceutical manufacturers to voluntarily label their medications. To date, only a few complied with this request.
The present status of the bill is that it's being opposed by the aspirin lobby. It's another indication that sometimes those who are in the pharmaceutical business aren't really fair to the public. They aren't willing to disclose the facts. I think we have a chance of passing it. It's an uphill battle because unfortunately the aspirin lobby has the support of the administration in opposing the bill. Notwithstanding that, I think we have a chance to pass it, and I'm hopeful we'll pass it before the next flu season, but I'm not at all certain.
The Foundation's opinion is generally we realize that the aspirin issue is still very controversial, but we believe that parents should be warned that there is possibly a link between aspirin and Reye syndrome. So we are in favor of the labeling of all aspirin products, and even to the point that the label states that under certain symptoms, when a child has certain symptoms, not to give them aspirin. Well, it's very difficult to distinguish the symptoms of flu and chickenpox from a common ordinary headache, so that we feel that aspirin should not be given to children unless under a doctor's supervision.
Numerous over-the-counter drugs contain salicylates, including a variety of pain relievers, cough and cold medications, and even some anti-nausea products. As a result, the Reye Syndrome Foundation is recommending that parents read ingredient labels carefully on all medications before giving them to children or young adults.
A large number of aspirin users are self-medicating in the teenage group, and we are now seeing during the last 2 years a higher incidence of Reye syndrome occurring in this older age group, and therefore we need to inform them about the risk factor involved in the use of aspirin in the development of Reye syndrome.
While discontinuing the use of aspirin in children who exhibit viral symptoms is important, it's equally important to keep in mind that aspirin was not used in over 1/3 of the documented Reye syndrome cases. However, the actual number of documented cases is believed to be highly inaccurate.
Even though there are laws that say this is a reportable disease in most states, about 44 states at the present time have public jurisdictions that Reye syndrome is a reportable disease. This is not the type of a law that's enforced with fines or anything of that nature, so it is, what it boils down to, is a voluntary reporting system, and we fully believe that the number of cases reported to us is an underestimate. And we believe that somewhere between 2 to 4 or 2 to 5 times as many cases exist as are reported to us.
In Ohio and Michigan, where major public awareness campaigns have taken place, the incidence of Reye's appears to be the greatest. But with the reporting of Reye syndrome so lax, even in these states, where awareness is very prominent, the number of cases that are actually reported is probably wrong.
I think there has been a number of cases documented in the adult population.
The reasons for the vast disparity in reporting vary, but the effect these numbers have on research doesn't. Lack of adequate reporting seriously hampers research fundraising efforts.
I know the primary goal of the foundation is to eliminate Reye syndrome as a medical problem. And the question is, how do we go about it? Right now, the federal government is decreasing funds spent on Reye syndrome research.
In addition to research being a top priority, many feel public awareness is of equal importance.
I sent out about 500, 600 letters to pediatricians describing what happened to us, with a pamphlet trying to be aware of it. Got very few responses. I even got a call from several pediatricians and say, gee, let's not start anything among the families. We'll get a lot of phone calls. Let's not start a panic. I tried to talk to PTA groups and go to schools, nursing units, and I was told that this is not the kind of thing we want to do in a school. We don't want to stimulate anxiety or stress. It's so rare you never see a case. Well, during that following year, it was approximately 15 cases in Washington, and you wonder how many cases are missed or diagnosed something else. So not only was it a very traumatic event for myself, my wife, my daughter Stacy to grab a hold of, losing a healthy 11-year-old, but to try to initiate some kind of awareness, not only among families and parents, but among our own medical community, which was tougher.
Awareness is one of the things that we can do right now to save lives. Like in most disease, Reye syndrome, if diagnosed early, the chances of survival are a lot better.
When Taisha Hart came down with Reye syndrome at age 3 months, like most Reye's parents, her mother, Gail Austin Hart, an Air Force sergeant, had never heard of Reye syndrome.
I didn't even know what it was when they told me what it was, and the military doctor involved got some information for me so I could find out what was going on. And I had not given her any aspirin, which was usually put in conjunction with Reye syndrome, but I had read that in children of her age at 3 months, it does come on suddenly with the seizures, so that was typical of a child of her age for Reye.
Had Taisha been ill prior to Reye syndrome?
She was growing normally, everything was fine. She laughed, she made noise, she played with her toys, everything was normal.
Had she had any cold symptoms, flu symptoms?
She had a slight cold, but she didn't have a flu. Okay, she had just had her 3-month-old checkup just a week before the incident, and her checkup was perfectly fine and healthy. She was progressing where she should have been at, and I had put a humidifier in her room to help her with her little bit of congestion. And the doctor had said that because of the climate we were in, that was typical for children of her age. So what I had done was perfectly all right.
What are the effects in Ty's case as a result of Reye syndrome?
Okay, when she first came out of her coma, she didn't react to sound, she didn't react to light, she didn't track at all, and you'd slam things around her, she wouldn't move. So right then and there we knew she had a hearing problem and a vision problem. She wouldn't move at all, she just kind of laid there, nothing at all, nothing like even a newborn baby would do. She didn't do anything at all. And gradually she came out of all that, and she hears really well now. She still has a hearing problem. She has a middle ear infection in her left ear right now, which we're working on right now. Her vision, we're not sure what she sees. We know she does see things, she does follow people, but she doesn't track like she should. She doesn't follow a light a certain way, she only follows certain color lights. Her motor skills, she's just started rolling over, which is a big achievement for her because she hadn't been able to do this at all. And she started doing that about 3 months ago. I believe in March she rolled over once, and I thought, gosh, she's going to do it again, and she finally did it. And so now she rolls over all the time. She does move, and she does move around on the floor. She can try to scoot herself forward. She does make sounds, you know, she's trying to make the dada sound. She does do the dada sound. But as in making full sentences, no, that might be like when she's 9 or something, if then, she does it. But she does make sounds, she does communicate. You know, and she knows when people are talking to her, and she knows when she does things wrong. She knows when she's bad, when she's good, just like any other little 3-year-old child. You know, she does communicate in her own way. You just have to be around her, get used to her, know what's going on with her.
Is there an ongoing treatment for Ty?
Yes, right now Ty is in the Hospital for Sick Children in Northeast D.C. And basically what they do for her there is she's on a daycare program. She gets therapy every day. Sometimes, you know, she might not get it that day, but out of the week, I'll say 3 times during the week she will get therapy. And what they do in physical therapy is they move her muscles and get her to learn to roll over or learn to sit up and move her head in a certain position. And since she can't do it, they got to teach her how to do it. You want to open up your eyes? You want to wake up? You not be sleepy? Ty. Ty. You're cheating. I'm going to talk about you bad tomorrow. I'm going to call Grandma up tonight and tell her what you did. I'm going to say, Grandma, Ty was horrible all day. Wanted Passy all day long. It was her big chance and she went to sleep. Ty. 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 I should have brought Christopher. I should have left you at home. I'm just kidding. Sit up. Sit up. I'm going to take Passy away from you one more time. He's cheating. I'm taking him away. Life is just so rough. Oh, Mommy. I'm sorry. Don't cry. Don't get upset, okay? It's not that bad.
Reye syndrome remains a medical mystery. At the present time, there's insufficient data to show who may contract Reye or how frequently. But available data shows the incidence of Reye is highest during the winter flu season and after chickenpox. Now, what should this mean to you? Since some research does show that kids who are displaying Reye symptoms during or shortly after a virus are correctly diagnosed and treated in time, their chances for recovery are very good. Early treatment does seem to make a substantial difference. So if your child is recovering from any viral illness and suddenly begins to vomit uncontrollably, becomes extremely tired, shows a personality change, consult your doctor at once. Tell him you suspect Reye syndrome. A simple blood test can confirm it, or better yet, rule it out. And please remember, never give your child aspirin if he or she has a cold, flu, or any virus. Always check with your doctor, and a child who has any symptoms should not be given medication. It could make it worse or confuse test results. The final note. Now that you know the symptoms of Reye, tell someone else. Here's the address where you can write for more information. The National Reye Syndrome Foundation, 426 North Lewis Street, Bryan, Ohio, 43506.